So for what we have for the fever and convulsions in children, there was a question which was asked. They said that a 2-year-old boy was brought to the EPU with 2 days history of fever and a history of convulsions. So you should list 5 important questions you ask you can be asking the child some questions if the child is actually brilliant and grown up, and also the parents, So 5 important questions you would ask. You should also talk about the 5 physical signs you try to pick up from the patient. You should mention 5 differential diagnoses. Then you should outline management for any preferred diagnosis you feel was actually wrong, So the most likely diagnosis is simple febrile seizures. Okay, so it's a clear exam ready questions they usually ask on febrile seizures, So 5 important questions you ask the patient or the parent that brought them is they should describe these convulsions. How long has it been there? Okay, is it on one side of the body or is it the whole body? Highest recorded fever. Okay, when does the fever start before the seizures come in? When they have the seizures, do they have any associated symptoms like cough, catarrh, vomiting, diarrhea, and the rest of them? Okay, so you look at the cough, you look at the catarrh, you look at the vomiting, you look at the diarrhea, look at the rashes. The past medical history, have they been having seizures before? You look at their developmental history, even go as far back as looking at the birth history. Were there any issues that happened around when the mother was giving birth to the child? Did the child cry immediately? Were they placed on oxygen and all of that? Look at the medical history and any treatment that was given at home. All right. So 5 important physical signs to look out for is look at the level of consciousness after the seizures. You look at temperatures. Okay. You look at the signs of central nervous system involvement like neck stiffness, bulging fontanelles, irritability, photophobia, then focal neurological deficits. Then you also look at if there's signs of infections anywhere, right? So 5 differential diagnoses apart from the simple febrile seizures. So, simple febrile seizures is there and it's your top diagnosis, right? The complex febrile seizures could be meningitis or encephalitis, could be cerebral malaria, could be epilepsy. Now for our school, they always wanted to discuss malaria. Well, that's complicated malaria. I don't know, but it's actually the most common thing you see around this part of Africa. So they always wanted to discuss the most common thing you see. Okay, so outline the measurement for the most preferred diagnosis. Okay, we are discussing simple febrile seizures because that's actually the right thing. So first of all, you have to resuscitate, so ensure that the child is breathing, the airways are patent, circulation is nice and all of that. You treat the fever with paracetamol, tepid sponging, then encourage oral fluids. Okay, identify any fever. So if there's any infections, okay, viral infection, bacterial infection, you tackle them. All right, then parental education's reassuring, okay, and all of that. Okay, so you can see that if you want to discuss febrile seizures, there's nothing much to say, but if you want to discuss complicated malaria, there's a whole lot of things to say. So our lecturers here, they always